All right, thank you for staying with us. The Monday Report annual session is about to come to an end. There are so many questions. We'll try and squeeze them in and separate the facts from the fiction. Currency is another concern. People are saying now that we exchange hands with a lot of money, what happens now? Masika.
Well, it's of course it would be best if you don't use currency, but that is impossible. I know we have options, but they are not always applicable. So the best thing, as we said, is clean your hands as often as possible. Every time you think you've touched something that is suspicious, clean your hands, avoid touching your face, avoid touching your nose, and that will help you for
So we try go cashless. Church, people are saying that in church, the moderator and the senior pastor is using the same microphone to worship, giving people the microphone to say hello to them and also anointing them. Is this a problem, Professor?
It is a problem.
Yeah.
Actually, what we are saying, for the duration that we are still going to have the problem, we must avoid excessive contacts with surfaces, excessive contacts with the others, and just regular washing hands, sanitizing, and as Masika said, we touch our face how many times?
You even do that consciously.
Yeah, unconsciously, isn't it?
Yeah.
So now you have to consistently remind yourself, don't touch your face.
Okay. Mike from Eldoret says, what are the goods that are being imported from affected countries? Can they carry the virus? And if they are contaminated, what measures should be taken since they are not sterilized?
The duration, Masika, the duration of time. Let's say there's a ship that has left China. How long does it take?
2 weeks at least.
2 weeks. Goods from Europe, how long do they take? More or less the same period of time.
Yeah.
I think that it's unlikely that during that period of time, the virus will still be what? Alive and active. But nonetheless, if there is excessive fear, then we have seen other countries where there's already been outbreaks going to the extent of what? Of really trying to sanitize all these areas.
Yeah.
With ships coming in, goods coming in, planes, trains, and all these things. But Kenya has not reached that level.
Okay.
But what we can do is just prepare ourselves just in the event that we have the outbreak in this country.
All right, let's take 3 questions at a time, have them answered really quick. Start from there. 1.
Now, Trevor, really, quick question here. I had a question. Now, apart from the sanitizing and cleaning, is there other basic ways maybe we can, do to prevent, this thing from the service section? And maybe as an economy, are we at stake because the investors might, get scared?
Okay.
Yeah.
Next question.
Quick one, Doctor. I'm Moses Gatiba, an online taxi driver. Is it true that there are tourists who are beating the screening, like taking antibiotics before they board a flight, like 6 hours too, so that when they get there, their fever is lower than normal?
Suppressing the symptoms. Oh, wow.
Hello.
It's an intense question.
I'm Kyoko. So my question is, there was speculation early this week that Israel had got an antidote. So are those just fake news? Or is it real?
Let's have those questions answered first.
Okay. So
the issue of vaccine. Do we have any vaccine? Yes, no.
I will start with the guy on the first seat. You had asked what else can you do. There are several things you can do. Clean surfaces frequently. If you're sick, avoid traveling. Otherwise, you're risking being quarantined in some strange place. And also keep distance from sick people. As we said, 2 meters, 3 meters, and get the right information.
Okay.
We are having a lot of false, fake information. Get the right information from the right sources, the government, WHO, CDC, such places.
Okay.
Secondly, the economy is going to take a hit. It has already taken a hit. Actually, I was checking last week, the numbers were a loss of 8 trillion. That's equivalent to 4 times the Africa GDP. And that has been lost in a year. It's quite high. You're going to take a hit, including in Kenya. Why? Because production and many other things, movement, tourism, all that is affected.
Okay.
The other question was
is
about...
Is it possible to suppress the symptoms?
Yes, and that happens all the time.
It is.
So in fact, if you have a fever, the normal reaction, even if you're not trying to beat the system, is to try and treat it.
Yeah.
So if you take some medication, they could mask that. But what we are relying on also is screening at the port of exit. Because when people are traveling out of these countries that are sick, no country wants to be blamed for taking the illness to another country. So many of them are putting measures to screen at that point and also screen during entry at the port of entry. But it's possible that even by the time you're getting to the country, you don't have symptoms because you're in the incubation period. Okay. So it's not tight. What you need to have is tracing the contacts properly. So that, tracing the persons properly so that you have their contacts and you can follow them up.
All right.
Prof can comment on...
But in addition,
yes,
the airlines are also interested in ensuring that their crew is actually protected.
Mm-hmm.
So they ensure that the exiters, Masika said, all these individuals are checked.
Okay.
Now, the issue of Israel, those are the stories that are coming through. What we know very well at this point in time is that there's no vaccine for coronavirus disease 2019. Number two, we know that the nearest we are is drug development because some drugs were started before. There have been 2 other outbreaks of coronavirus. The first one was in 2003, severe acute respiratory syndrome, SARS. And then in 2013, we had MERS-CoV, Middle East respiratory syndrome. So drugs were being developed. But then when this epidemic went down, they stopped. So they have taken over very, very quickly. So what we are likely to see very quickly is development of antiviral drugs against corona.
Okay.
But the vaccine will come later. So when somebody says an antidote, I don't know whether they mean a vaccine or a what?
Or an actual drug.
Or a natural treatment.
Okay.
Yeah.
All right, let's take the other 3 questions really fast.
Yeah, so Dean Kuntz in his book, The Eyes of Darkness, seems to point out the possibility of coronavirus being a bioweapon. Medically speaking, do you believe coronavirus could be a bioweapon?
All right, next question down here.
Yes, my name is Purity. My point of concern is actually to the Kenyan government. You see, we've allowed these guys to enter in our country. You see, according to the stories we are hearing, nobody who has a solution to coronavirus. And we should be very careful when you're allowing other people to come in our country because we are prone to this disease.
Question.
So my concern is that we should not allow people to get into our country because this one is making Kenya to be prone to the disease.
It's in 68 countries.
Yeah.
We should not allow anyone to come in. Is that practical?
Actually, movement is one of the challenges we have in the countries which have the infected people.
So we should remain locked and lock everybody else out. Is that what you're saying?
Yeah, it's
68 countries.
No, I don't mean all the countries, but I mean the importers who came.
Okay.
Actually, that was one of the point of concern.
All right.
Yeah.
Next question.
Yes, I'm Majiwa Gideon, Secretary General, University of Nairobi, and doubling up as a dental surgery student. My question is to the quintessential experts here. As experts, have you prompted the government to aid in recruiting doctors who are out here who are not hired by the government, so as to also avert these situations? My next question is...
One question, please. Okay. Next.
Okay, next question.
Thank you.
Yes.
Thank you very much. My name is Esther. I am a 5th-year student of medicine and surgery in the University of Nairobi as well, and we train in Kenyatta. I can confirm we are safe. It is not that bad. Anyway, I would like to challenge Kenyans that please, let's not wait until we have a virus outbreak like this to realize that our hospitals are understaffed and under-equipped.
Okay.
Please, we need to handle all other conditions just like this because this virus is just like any other virus.
Okay.
Thank you.
I'm waiting for the 3rd question. Go ahead.
My name is Anthony Nkubi.
Yes.
I'm going to speak from a governance point of view.
Yeah.
And my concern is, we can conclude from what you have learned here tonight that there is a lot of misinformation and also that the government need to give more information to the public.
Okay.
So I really wish that the committee that was put in place the other day, led by Mutahi Kagwe, that one of its core mandate is to sensitize the public. Okay. Because you can imagine how many people here, I mean, in the country do have access to television and internet. Okay. So for me, I've learned a lot, but what about that person in the village who normally go with his normal life every other day, and he can really contact this particular epidemic? Okay. So the issue of information, the government needs to come out very properly on that.
Question over here.
My name is Bushnell Bundi. I'm a medical student at University of Nairobi and a student leader. Okay. My question to my lecturers is, could they shed light on the different types of spreaders. There's a super spreader, there's a low risk spreader, and all those types of spreaders.
Okay.
Yeah, exactly.
Now I have 3 questions. Professor, bioweapon, recruiting more doctors from Majiwa, and types of spreaders.
So bioweapon, you see, what has happened is that there have been books written before.
Yeah.
There have even been movies. All right?
And movies.
Yeah?
And movies.
And movies. There have even been movies predicting, oh, this will happen. It's all science fiction. But sometimes it becomes a reality in the sense that we are seeing something that looks like it was a movie. But the truth of the matter is that this virus is not a bioweapon. This virus actually spilled over from the animal to the human, because SARS has happened before,
Okay.
MERS-CoV has happened before, and these are coronaviruses, and we can link them to an animal source. Okay? So the only issue now is that for the corona 2019, we are not clear about the animal. What we think is a bat, but they are saying there was an intermediary. That's what we don't know exactly now. But the issues of bioterrorism, this is always the story that goes on all the time. But I don't think that this particular virus has been designed for that reason.
Okay. Advice
It is
to
just a
government.
spillover from
the
animal
animals.
to the human.
Advice to government on recruiting more resources and doctors like Majiwa asked.
I think that issue is an issue that I'm really not in a position to actually talk about.
So you don't think throwing numbers would help?
You know, the doctors who are out there and are not employed is unfortunate. But employing more will not really stop the coronavirus. What we actually just need is to put measures in place.
Okay.
What I said before, ensure that we allay anxiety, we train our healthcare staff very, very well, and we communicate on a regular basis. Let's not wait to try and communicate when there's a rumor.
Okay.
Let the government communicate how they have prepared the Western region, how they have prepared Central region, how they have prepared Coast. Then that will actually allay what?
The fears.
Allay the fears and the panic.
Types of spreaders.
Yeah. Now, these are words we should avoid.
Okay.
All right? Because they have no basis in science.
Mm-hmm.
Yes. There's no super spreader. What is super? As far as I'm sitting here as a scientist, those are words that are coined up by what? By the media. Okay?
I didn't ask it. Just it wasn't my question.
honestly, I'm sorry to say that, but it is actually the truth, because when you are infected and you are secreting the virus, you are secreting it into the environment. Anybody close to you will actually do what? If they get into contact, will get infected.
Okay.
It does not really make you a super what?
Spreader.
A super spreader. I'm hearing all these terms, but in terms of science,
they have no basis.
They actually have no basis.
I'll take the last 3 questions very fast. Yes.
My name is Patrick Kamodo Gidinji. My question goes towards asking, do we have an innovative way of having this mask? I understand Muslim women have buka. Lastly, do we have traditional way still of knowing whether we can mitigate the virus through either like Maasai, they use tobacco to minimize the outcome of flu?
Okay.
That is the question.
Traditional ways of intervention. Any other question over here?
Yeah, please, for me, please.
Yes.
For me, it's an observation that this time was very short. We should have had some more time because we are doing something called civic education.
Okay.
Number 2, I have requested your presence in our meetings because I have decided we are not going to wait for government to come and educate us. We will just take the challenge and educate our members.
Good.
We will be having 4 meetings this month, the month of March. Can I rely on you to come to our meetings and educate our members?
Okay. We will get confirmation
we shall
from
come.
them.
Just let us know when.
Great.
And where.
Question over here. Yes.
Okay. I'm Teusi, and my question is, we are living in a country where we depend so much on the border trade with the neighboring countries like Uganda and Tanzania. And what's the measures that government is taking with other countries, except on Kenya alone? Because when the coronavirus it's in Tanzania, it will easily get into Kenya.
Okay. Yeah. All right, coordination. I believe there's one last question over there. Yes, go ahead.
May I like just to ask the professor, the doctor here, that the most people who are very, very, very important is the transport industry.
Okay.
Those are the people who can transmit this disease as fast as possible, very quickly.
Okay.
So I'll just urge the government to equip the people who are in transport industry so that they can be the people who shall raise the flag when there is an issue.
Okay. All right.
So I don't know how prepared they are.
Okay.
This issue.
Majiwa had a burning concern over there. Very briefly. Yes.
Well, it was majorly, it's a major concern, and also it's a word to the public and probably to the health practitioners. I believe the health practitioners have the knowledge, the succinct knowledge that can be moved to the masses, and so they should take up this chance to give facts, figures, and data to the public, so that we do not have myths coming around everywhere about coronavirus and its implications and everything. And also to my fellow medical students, take up this mantle also, serve the citizens of Kenya by giving them right and correct and accurate information to the public. Thank you.
We have Boaz here, who's the chairperson, Kenya National Union of Nurses. Do you have that information? Do you pass it to the public?
Thank you, Trevor. We can only pass information that we are sure of. And that is why I started by saying that if you haven't been given or passed on information from the government, because I believe that is where the whole information lies, I, as the primary health care, I can only do what I can. If I haven't been provided with the preventive tools, because we all prepare, and when it comes to such issues, even when an accident happens, we are always told your safety comes first. So even if I have that information, but I don't have the requisite equipment that I require, then at that particular point, my judgment will serve me. Am I safe? No. Then what next?
Flight.
Thank you.
Yeah.
Okay. Trevor, with the current corruption indexes in this country, we might not trust some of these people with some of these facilities. You can find, maybe the government will provide the gloves.
Yeah.
And we find these gloves in some rural areas people have taken to the folks. There was a case of Olympic materials being found to some people. So what is the surveillance to make sure the officials who are given the care to make sure the Kenyans get the quality of what the government provides? For sure.
Okay. Yeah, go ahead. You have a question.
Yeah, I'm Robert McLean, a student leader, and my Secretary General hasn't mentioned this, but we have students in Wuhan.
Okay.
And I'd like to challenge the government, kindly bring back the comrades home.
Okay.
Thank you.
Okay. So there's another question coming through that in the event that 20 people get infected after being quarantined, then what next? As you answer all the questions that have been brought up.
Just take that again.
If there are 20 people who've been infected with the virus,
yes,
what are now the stages from there? After quarantine, now we've seen that they're infected. Then now what?
If they're infected, they'll actually be isolated in a treatment facility, and they'll be taken care of. Some of them may get severe disease. They will need different levels of care. There are those who will need a bed and rest and the usual painkillers. There are some that might need even ICU. So the level of care will be dependent on the level of illness. So that is isolation in a facility. I think I also need to chip in this. I think Majiwa, the part-time student and full-time politician. It is true that the government should hire the unemployed doctors for one reason, not for coronavirus, but because they've spent so much money in training them. And we actually don't have enough doctors.
Okay.
That said and done, we also need to, I think, Purity, you mentioned about locking our borders. That would be the wrong thing to do, because we could also have cases in Nairobi. That doesn't mean to shut down Nairobi. Such fears actually worsen the situation. So we shouldn't rush to even ban flights, because it is not as effective as we would like to think. There are so many other countries which this could come from. Mm-hmm. And that is truly something that the public pushes for that isn't very useful.
Okay. There was a question about innovative ways of masking traditional medication that could actually quash the coronavirus.
Yeah, we really don't have. I wish we had, but we really don't have any herbs. You are talking herbs.
And tobacco.
And tobacco, sniffing tobacco. Yes. We really don't have any evidence to show that it actually works. So these are things you hear here and there. But really, if you are unwell, please seek what? Healthcare professionals.
So if somebody took lemon and claims that they got healed from it?
Yeah, that is just an anecdote.
Yeah.
It is just one person. So the whole issue is that if you are unwell with the kind of signs and symptoms we've talked about, call the nearest health facility, get advice on what to do. If you really feel that you have been exposed, please go to a health facility. They can quarantine you, keep you there for a while and see whether you have the virus or not. If you do, they'll keep you there till you are well. If you don't, then they'll manage whatever it is and then get you back into the community.
But the bottom line about this virus, it's not a death sentence.
Of course not. It is not.
Yeah.
It is actually not a death sentence. In fact, flu is killing more people than what? Than coronavirus. And flu, is seasonal. It is every year. During the winter months, the countries that have winter really suffer, a lot of flu. The only goodness is that they generate a vaccine for every season. So that way reduces the number of people who are infected, and they vaccinate the vulnerable groups.
So even the flu shot is not a one-size-fits-all for the influenza and viruses and coughs and everything?
Flu shot is for influenza, which is one of the viruses that causes the illness that looks like flu. So it's not for everything, but it does help with flu, with influenza, which is the most severe of these illnesses.
Okay. Yeah. This is essentially your show, so I'll give one burning comment from people who haven't spoken. All of you have spoken before, so we'll give the lady the chance back there. Go ahead.
Okay, hi guys, I'm Beatrice. I'm a travel agent, so I have friends in aviation, business. So I would just like to say, a few weeks ago we got a website thing to sign a petition to stop direct flights, but I couldn't even open the website because, hey guys, I want to go and see the Great Wall of China. So after all this, without getting into stigmatization, and everyone has something to say about something right now, so let's not forget China is a beautiful country. So after all this, we still want to go and have some nice China food.
How is the travel agency looking like? Are people still booking flights? What's going on? What is your assessment like? Has it dipped? Is it okay? What's happening?
We have so many agencies, so different results.
Yeah, from your own assessment.
I would say guys are still traveling. The flights are still ongoing. The taxi can have apps to tell them the flights are landing, who wants to go where. So I would say I'm not complaining right now, but it's the low season.
Yeah.
So that's what's up.
So we should all go see the Wall of China.
Hey guys, don't worry about Corona. We'll solve it. The medical team are on it.
All right.
So yeah.
Thank you so
much.
The
only thing is that exercise caution.
Yeah.
Yes. Yeah, just during this period of time, exercise what? Caution.
Okay.
Yeah.
You're more likely to suffer from socio-economic effects than you are likely to suffer from the virus. The virus is very low odds of getting to you, but you will get some social effects, you will get some economic impact, because a lot of biasharas are not enjoying the current situation, and actually that is what will hurt most people. The virus will get to a few, and most of those will recover. A few of the elderly might die.
All right. And that's where we leave it for now. This has been, Professor, you have one more thing?
Yes, you have said about information. We are planning a big discussion at the University of Nairobi one of these days.
When?
I will let all of us know when.
Okay.
So we actually want to do a public discussion, maybe a bigger panel than this one, just to be able to disseminate information that is correct, that is well synthesized.
Okay.
So look out for that announcement when it comes. So we shall be at the University of Nairobi main campus talking about the same thing. So we will let you guys know the time and the day.
Brilliant.
Yes.
Dr. Moses Masika, virologist, UON, CAVI ICR, which is Institute for Clinical Research, and Professor Omu Anzala, virology and immunology at the University of Nairobi. Thank you so much for making time and helping us make facts from fiction on the coronavirus. They said it's not a death sentence, all right? The stigma itself will hurt more than the actual virus. That has been the Monday Report. My name is Trevor Mbija at almost 11:30. Thank you so much for staying with us. Let's do this again next week. And I promise you, we will have this discussion again at some point, all right? Good night for now.